Let's go back to Plateau State and talk a bit of health. Though the state does not have any record of the diphtheria in bacteria disease, the state capital residents there have called on stakeholders to ensure quality healthcare delivery to citizens in the face of killer diseases. In this report, News Center's Chizoba Anionwe looks at measures to be taken to ensure the state remains safe from diphtheria.
Diphtheria disease, according to research, is a bacterial infection that usually affects the mucous membranes of the nose and throat. Studies show that vaccination is the most effective preventive measure. Hence, countries with higher vaccination rates record the least of the infection. However, many other countries of the world with limited healthcare or vaccination options, which Nigeria is not an exception, still experience high rates of diphtheria. Plateau State is among 9 states in the country that have not recorded any outbreak of this disease.
Most of those who in those areas of this country that have been found to come down with diphtheria are people who you find out were not either adequately immunized or were not immunized at all. So, but for those who are infected, yes, there is treatment. Diphtheria is treatable.
Prevention, they say, is always better than cure. It is also cheaper at the preventive stage rather than allowing scarce resources to be wasted on matters that can be prevented.
Hand washing, right? So, people must form that as a habit, not as a rule to prevent a disease, because it's universal prevention. Now, the wearing of masks, I know we've lowered our guards on that with, COVID, but we still advise people, most especially, people who have what we call comorbidities. If you have some other health challenges already, we advise if you're going to, where there are a lot of people, it will be good to still put on your mask.
Though diphtheria can be treated with medication, especially when presented at an early stage, there is need for awareness creation for many who know nothing about the bacterial infection.
Every patient who comes into the hospital, you come in with a child, you come in with an older person, there is need for you to be told that diphtheria is serious, it is real, and you can come in contact with it if you do not take the vaccine.
There is a need for government to do a lot of sensitization, also to create such awareness that people should be aware of such things.
It needs quick intervention from the government, from relevant stakeholders. They need people to know about this disease.
People who are at higher risk of contracting diphtheria include children. Adults living in crowded or unclean areas are also at risk, especially those who do not have up-to-date vaccinations. Chizoba Anionwe, reporting for News Central.